Opioids are a class of drugs that include natural opiates from the opium poppy, such as morphine and codeine, semi-synthetics like heroin, oxycodone, and hydrocodone, and synthetics such as fentanyl, methadone, and tramadol. Their mechanism of action involves binding to kappa, and delta opioid receptors in the brain, spinal cord, and GI tract, which inhibits pain signals and releases dopamine. Medically, opioids are used for severe acute pain, as in post-surgical or trauma care, for chronic cancer pain and palliative care, for severe chronic non-cancer pain as a last-line therapy, and for cough suppression with codeine and as an anti-diarrheal with loperamide. Opioid use disorder is a pattern of use leading to significant impairment, characterized by at least 2 of 11 criteria in a 12-month period. These criteria include taking larger amounts or using over a longer period than intended, a persistent desire or unsuccessful efforts to cut down, craving, failure to fulfill major role obligations, continued use despite social problems, and the development of tolerance and withdrawal. Signs of abuse and overdose can be behavioral, such as doctor shopping, social withdrawal, and neglecting responsibilities. Physical signs include constipation, pinpoint pupils, drowsiness, and slurred speech. The classic overdose triad is unresponsiveness, respiratory depression, and pinpoint pupils. The treatment for overdose is naloxone, also known as Narcan, which is a competitive opioid antagonist. It is available as a 4 mg nasal spray or as an intramuscular, intravenous, or subcutaneous injection. The standard dosing is to administer 4 mg intranasally or 0.4 mg intramuscularly, repeating the dose every 2 to 3 minutes if there is no response. Multiple doses may be needed due to its short half-life, especially with potent opioids like fentanyl. The management of opioid use disorder involves medication-assisted treatment. Buprenorphine, a partial agonist, is administered as a sublingual film or tablet to reduce cravings and withdrawal, and is initiated during mild to moderate withdrawal. Methadone, a full agonist, is given as a daily supervised oral administration to manage withdrawal and cravings. Naltrexone, an antagonist, is available as an oral medication or a monthly intramuscular injection under the brand name Vivitrol, and it blocks the effects of opioids but requires full detoxification before initiation. Complications and public health impacts include respiratory arrest and death, an increased risk of infections such as HIV and Hepatitis C, neonatal abstinence syndrome, and significant societal cost and mortality. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.